Hi, my name is Quinton and I'm from Pain-Free Physiotherapy and Allied Health. I'm here to talk to you about sciatica. Now, sciatica is a type of condition that describes the pain felt along the sciatic nerve, and this starts from the lower back and can run down the back of your leg. Now, depending on where the sciatic nerve is affected, symptoms can be different for everyone. Sciatica is often the result of nerve irritation or compression of the sciatic nerve. And some examples of some common causes may include a bulged disc or maybe a abnormal bony growth or having a locked joint. So what are the common symptoms for sciatica? People with sciatica often report pain as the main symptom, but this can vary from feeling dullness, burning sensations, aching, to a sharp shooting pain in the lower back. Now, sciatica can also be described as weakness in that affected leg as well. And people can often complain that the symptoms are worse when they're sitting down, and then the pain makes it difficult to stand back up. So what will most doctors say to you? Your doctor may perform a physical assessment with a focus on the muscle strength, sensation, or reflexes. They may also get you to get some form of imaging such as X-ray, CT scan, or MRI scan to look for any other problems. Now, it is quite easy for them to associate the findings of disc degeneration or disc bulges with your symptoms, and in that way give a convenient diagnosis. However, this is not necessarily the case. It's like saying as we grow older, our hair will grow grey, but that is just part of a normal aging process. Likewise, when we grow older, our spine will start to show some degeneration or disc bulges just as a normal aging process. Now, your doctor may also prescribe medication to help with the pain relief. Although this may reduce the pain, that does not actually resolve the problem. However, this may be encouraged initially in the short term only if the pain is limiting some of the activities you do every day. And then some other common self-management strategies include rest, but it is quite important to keep as active as you can as soon as possible, while being careful not to perform any excessive bending or twisting movements. In most cases, sciatica will resolve by itself within 6 weeks to 3 months. And for extreme cases, elective surgery may be an option to free up the space or relieve the compression of the nerve. Although there is still about 1 in 20 chance that the pain will return in the future, but in some cases, the surgery doesn't change anything at all. So what do we do differently at Pain-Free Physio? At Pain-Free, we're experienced at using a holistic approach to assess the body as a whole and then treat your symptoms rather than just focusing on the low back. We perform a head-to-toe examination to look for all contributing factors. Most of the time, we find that the cause of your symptoms or your sciatica is not actually in the low back, but somewhere else, and it could be in the calves or in the shoulders. So if we use the human body as an example and we split it up into 3 zones, we have the upper body, the trunk, and the lower body. The trunk is built to be nice and strong, like this tight spring, and then our upper body and lower body are quite loose for us to move around. But if we flip it around and we find that the upper body and lower body is quite tight and that the middle zone, our trunk, is quite loose, when we move around, there'll be excessive movement in this area, and that causes the low back pain. So treatment-wise, we can identify those tight structures in the upper and lower body and try and loosen them, or we could provide extra stability in that middle area. So at the end of the initial assessment, we'll be outlining 3 main things. 1, what is the cause? Now, as I mentioned before, it could be anywhere in the body, and it doesn't have to necessarily be in your lower back. 2, what treatment do you need? You may be surprised that we don't have to even touch the low back. And 3, how many sessions or how long will it take for you to achieve your goals? And most of the time, we will see significant improvement within 3 to 6 sessions. So what are some strategies that can help? We will give you a home exercise program based on where the cause is. If we find that the shoulder is the problem, we will give you exercises for the shoulder even if the symptoms are coming from the low back. Let me show you how. So most of the time, if we find that infraspinatus is the cause of the problem, we will give you an exercise to help release that muscle as part of your home exercise program. And all you need is a pocket physio. So usually we'll let you know and feel what it feels like when you're pushing on that muscle. Then put the pocket physio against the wall, and then you want to lean into that pocket physio. And to make sure that you're on the spot, you can move side to side to put more pressure on it, and you'll feel quite sore. So if you're following the mainstream ways by your doctor or physio and still frustrated about your low back pain and sciatica, feel free to come and talk to us, and we'd be happy to answer your questions and tell you what we do differently for your condition.